Hello everyone. I'm going to talk about modern trends in treating arthritis. As we all know, arthritis is a condition which come and affect youngsters as well as old people. In youngsters, we categorize them as patients with rheumatoid arthritis and other seronegative arthritis, whereas in older age group, it is called osteoarthritis. As we all know, osteoarthritis is a challenge for all surgeons in the earlier days, and if a patient gets affected with osteoarthritis, the cartilage gets eroded as the day passes and comes to a stage where bone comes in contact with the other partner and causes more friction and pain. There is nothing to replace the God-given cartilage, but there are modern treatments which has come up very well, which can produce the God-given like cartilage, not the exact one. We can never replace it, but similar to the cartilage which was there, it's called hyaline cartilage. We can give hyaline, we can produce hyaline-like cartilage. But before that, in earlier days, when a patient comes with arthritis, they used to treat them with painkillers and give them some steroid injections and do some physiotherapy and get going with the activities of daily life, modifying the lifestyle and other things, and finally they end up in a knee replacement or a hip replacement. But nowadays we have different forms of treatment which has come up, different physical modalities which has come up, and also different types of injections we can do. Injections itself, they have come as hyaluronic acid injections, which is glucosamine and chondroitin sulfate mixture, which is the composition in the synovial fluid, and also latest we have PRP, platelet rich plasma injections. It is getting very popular because it is our own blood we are giving it, and apart from the regular treatment of physiotherapy and anti-inflammatories and joint preserving medications, we give these type of injections which patients also prefer because it is from your own blood. We take about 40 ml of our own blood and we put it in a centrifugation machine, and it separates the blood into red cells, plasma and platelet rich plasma. And this 4 ml of platelet rich plasma which we get is the one which you are going to inject into the joints, and it gives wonderful results, and it takes about 4 to 6 weeks to kickstart, and once the process kickstarts, the patient gets definite benefit, and they can buy time before going into a final stage of joint replacements. And prior to that, we never used to do any joint preserving surgeries, but nowadays we do a lot of joint preserving surgeries, which include stem cell procedures, where we take bone marrow, blood from the bone marrow, and stem cells are produced which are on centrifugation, and we do keyhole surgeries like arthroscopy, and we debride the area which is damaged, the cartilage, and we create microfractures, and we inject the stem cells with a sealant which gets stuck to the area which is damaged, and over a period of 6 weeks it heals and forms a hyaline-like cartilage which has got a very good results. People prefer that, and it gives time before to carry on with normal activities as before, and they have come up with very good results, and the literature shows it is one of the best treatment nowadays. And later on, final stage is a joint replacement, which we know many things about it. But joint preserving surgeries, and also we have a procedure called chondrocyte replacement, which we take bone marrow from the patient, and we send the chondrocytes, the cartilage producing cells, to a lab in the laboratory where they reproduce millions of cells into it. It's called a regrow procedure, and this millions of cells, chondrocytes, that is the cartilage producing cells, are got back after 4 weeks. We take the patient for a keyhole surgery and create that area which is damaged, nicely prepare it with drill holes, and we inject the cartilage producing cells, and that also has got very good results. The outcome is very good. patients get back to the normal activities as they were before. And it has also shown to give good results, and nowadays people prefer these type of procedures rather than going for early replacement. And of course, we preserve the patients for early replacements when they are crossed all these stages and come to a stage where they cannot, rest of the other preserving surgeries are not to be done. And therefore, we advise people to come and visit us, surgeons who are capable of doing this procedures, and get the benefit of these early modern trends. Thank you.